So for those who are viewing us, welcome to another COVID-19 update. And today we will be speaking with Dr. Karen Gordon Boyle, who is our Deputy Chief Medical Officer at the Ministry of Health. Thank you so much, Dr. Boyle, for taking the time off to speak with us today.
Thank you. You're welcome. My pleasure.
Great. So COVID-19 cases in Guyana are rising daily, with some 800 confirmed cases currently. Can you give us a breakdown of the statistics, such as the hotspots, the demographics, and cases by sex, etc.?
I can. So our latest confirmed and validated report has our total as 881 positive cases with 36 new cases in there. The deaths confirmed as COVID 139, females 442, females representing their 50.2% of all cases. Age group, below 16, we have 102, 16 to 59, 686, 60 years and above, 90, and unknown, 3. So the majority of cases are those persons who are in working age group, 16 to 59, people who are up and about. In terms of the regional distribution of positive cases, Region 1 to date has 125 cases, 1 new one. Region 2 has 6 confirmed cases. Region 3, 46 confirmed cases. Region 4, 275 confirmed cases. Region 5, 2. Region 6, 8. Region 7, 176. Region 8, 12. Region 9, 170. And Region 10, 61.
All right, and of some of the new cases being reported, can you speak to any instance of person being reinfected? And what are some of the measures being taken as it relates to screening and testing in all the regions?
That's a compounded question. So the first part was what?
So I'm asking, of the new cases being reported, can you say if any persons got reinfected?
We don't have any known cases of reinfection so far.
All right. And what are some of the
the second question?
What are some of the measures being taken as it relates to screening and testing in all the regions?
So the idea is that we want all the regions to ramp up their testing. Mm-hmm. If you look at the numbers, we have very low numbers in Region 6. But when we check the number of tests that they've been doing, they have not been doing much in terms of testing. Likewise, Region 5. So those 2 regions have had the lowest testing rates. And so the urge has been on, we've communicated with the relevant persons in Region 6 that we need to see more testing done. And then we'll have a truer picture as to what's going on in that region.
How is the process of contact tracing progressing? What are some of the challenges and how has this process assisted in identifying other cases?
I would say contact tracing, case identification and contact tracing is pretty much the heart of controlling an epidemic. You're able to identify a case and then identify all the persons that case would have likely have come into contact with and get to them, alert them to their risk and confine them so that they're no longer potential risk to others. You're in a position to halt further transmission of the disease. Anything that prevents you from being able to identify all contacts, communicate to them their risk, and isolate them means you're going to be less effective in controlling your epidemic. Once we have cases, the surveillance team contacts those cases, and then efforts are made, of course, depending on how forthcoming that person is, to identify all the persons they would have come into contact with in the 2 weeks prior to testing. And then those persons are each contacted by phone, and they're advised as to their potential risk, and they are placed on quarantine. At the end of the quarantine, they're tested. But what we're finding is cases, some persons are not fully cooperating in terms of identifying persons who they may have put placed at risk. So we're unable to necessarily contact all those persons to ensure that they are quarantined. So that limits our effectiveness. And of course, sometimes you're given false names, sometimes you're given wrong numbers. A lot of time, effort, and energy is therefore then wasted on trying to really make contact with persons who do not want to be contacted. And I must say also, I want to use this opportunity to implore the public that when our surveillance team does make contact with you, that you should appreciate the fact that they're making contact for your own good, to advise you as to your risk and to keep you safe and the rest of your family safe, and to halt further spread. And unfortunately, sometimes the reception the surveillance officers receive leaves much to be desired, from persons outright being abusive, hanging up the phone, telling them not to call them back, you name it. So, I'm really disappointed sometimes in the way the public is responding to public health, doing what public health needs to do. People have to understand that we all have a role to play. The Ministry of Health staff are doing what they have to do. And as members of the public, I hope we all realize that we're in this together, that what one person does affects the rest of us. And so when one person drops the ball and doesn't, communicate effectively, does not tell us all their cases, or when we call to do what we have to do, people hang up or we're given wrong phone numbers, then you're going to cause the system to fail us all.
All right. And as we are on that, we see the ministry has moved to self or home isolation of some persons. How is the ministry monitoring these persons? And what are some of the reasons for going this route?
We're carefully weighing our resources, the numbers of persons who need to be isolated and quarantined, and the level of cooperation and sense of responsibility that we garner from the person. So persons who we know, live alone and can actually isolate and not present a risk for the rest of their family, we can possibly explore if with them the possibility of them being quarantined at home. It's a case-by-case basis that we will make these decisions. There are some criteria that the staff will use to decide who can qualify for staying at home and who will need to be in an institution.
And
as you can understand, some people, they're at home, they're supposed to be in quarantine, and they're in the market. They're going down to the wharf to collect some that was shipped in, and so they're obviously not taking it seriously. And another person would stay home and make arrangements to have, food brought to their doorstep or whatever. So there are different types of people. And so we have to be able to tell or get a sense of who we can possibly work with in partnership and who will just not comply.
And we know for a fact that COVID-19 research is ongoing globally. Have there been any new findings concerning the disease that people should know about?
There's mention of new strains that are pretty virulent, that are more aggressive. One point they were saying that antibodies do not last for very long, and so you can get reinfected. There were few persons who they said were infected, but then recently I was reading that they say the antibodies can stay in the body and provide some amount of immunity for a little longer than they thought originally. The truth of the matter is that it's still a very, very new disease. And so the communication and what is fact today may not be a fact tomorrow. And so I guess we'll have to say it's evolving. Knowledge is evolving.
Great, Dr. Boyle. Just before you go, we know for the past 5 months or so, you have been updating the general public daily of COVID-19 concerns. What continues to be your point of emphasis, even as the country is gradually reopening?
I think if there's one thing that if everyone were to take seriously, and I think it's something that's attainable or reachable, it's wearing the masks. If everyone including your children, right? Making sure your children have masks, because I see sometimes adults have masks and they have the children, sending the children to the shop and the children have none. But if everyone can seriously commit to wearing masks for the next 2 months, I think we can really make a difference with that one measure alone. And of course, if we can, practice the others, the hand washing and the social distancing, but so far, I don't think we've done such a good job in enforcing the guidelines. Maybe the public has reached a certain level of fatigue, as in having heard these things repeatedly, and after a while thinking, oh, I'm tired hearing that. So they just tune out. But the truth of the matter is we need persons to buy into this and take it seriously. We need law enforcement. We have some hot spots like the Kitty area and so on, where, we want people to, when you're living in those hot spots, maybe stay indoors as much as possible. And if we can have a police presence in those areas where we have more transmission taking place, and the police presence is just to make sure people are following the guidelines, not congregating, not having the parties, using the mask, etc. I think if we can come together and everybody recognize that we're equally invested in this, it's not a Ministry of Health problem. This is a Guyana problem. Ministry of Health is just trying to help provide some kind of guidance as to how we can beat it. But there's no way the Ministry of Health alone can make this work. It has to be everybody being equally committed to the process. So that would be my final word, I guess, that everyone has something that they can do. It may seem like nothing, but if everyone can wear a mask once they're out in public, even if it's just that, it will make a huge difference.
Do you have those hotline numbers at hand that you can possibly share with the general public?
I do not, but I do remember 181 and 180 off the top of my head because they're so simple. And I know that Digicel and GT&T are supposedly going to link those to the Digicel numbers to the GT&T numbers. So those ones I remember off the top of my head. I don't have the others on me right now.
All right then. So thank you so much, Dr. Boyle, for your time. And I do hope you enjoy the remaining of your day.
Thank you very much. Bye-bye.